So today we share relevant work that has been already happened for different audiences in different settings, and we try to find common ground, common goals, and I'm going to attempt to summarize these goals here. But first, I'd like to thank. I didn't jump so much. I'd like to thank the European Medical Association, of which I am a member, because this association intends to contribute to this recognition of qualifications and experiences across Europe, Europe broadly intended, including the UK, therefore, and Eastern Europe and further afield. And so this is a range of essential goals related to medicine in the broadest sense, and this slide shows the people I'm grateful for. But if you look at a few introductory points before the objectives, is the work of the World Health Organization in agreement with the International Association of National Public Health Institutes identified these 12 essential public health functions. Environmental health is hidden as a subset of one of those 12, health protection, which is dominated by infectious disease monitoring in terms of budgets and priorities. And so that's the situation in practice. If you look at the environmental health role in public health, and public health is broadly intended as an organized effort of society. That's a UK definition of public health. That means including medicine, including all the other professions and jobs. And the environmental health dimension of surveillance monitoring, emergency management, stewardship, planning, all those functions of public health have already been demonstrated to be relevant and actively pursued to the benefit of environmental health. So there is this kind of mismatch, let's say, by the need for environmental health to be promoted and the actual commitment of decision makers and budgets on that, usually. If you look at the research side, what has been driving the European Union programs is the exposome. The exposome is it's an attempt to, well, take the example of chemicals, chemicals being one aspect of the environment. But exposomics has been hailed as the response of the environmental health research community to the advances of the genome project and all the other omics projects. And so exposomes, exposomics, however, you could distinguish these two strategic approaches. Bottom-up exposomics is to actually account for the distribution of chemicals in air, water, soil, food, and therefore directly related to people. Whereas in terms of in groups of people, and therefore with their also social characteristics. Whereas the top-down exposomics is to take one blood sample and measure all chemicals in that one sample. And the ambition is there to simplify our knowledge of the biology of chemicals and relate that to other factors like endogenous factors, stress, and other circumstances. However, it is the bottom-up exposomics that has the only potential for prevention of chronic disease, because unless you reduce exposure where they occur, you will not achieve any health benefit. So therefore, there is a need of rebalancing on the research infrastructure, on research resources, some of these two approaches to exposomics and research in environmental health. And the World Health Organization has attempted, is now currently still attempting to guide countries to define the professional profiles that need to be recognized, and therefore people need to be then employed and supported to perform several tasks in all the areas of human activities, not just the health sector. The health sector is one of those 10 main sectors recognized to have an impact on health through the environment. and also the determinants from the environment, the natural built environment. You see, climate change is one of about 10 or 12 recognized WHO spheres for environmental health. All this complexity is attempted to bring together the advances in the service development, and the advances in the healthcare, and the advances in research, and put together a guidance for countries that would need to then use it. However, it seems to me that they need some simplification. They need some messages about what has worked and what should be used for education and training. And that's why I think the results of today may help the process WHO is currently undertaking, and also the process in the European Union and UK and elsewhere, to just make it practical. Because there seems to be a gap or discord between the scientific knowledge of the health determinants of natural built environment on health, awareness of what can be done about it, and our capacity to act. Now, we heard encouraging words from Francesco, so I'm very pleased to see this, practical solutions that have already also been identified. But several people suggested to limit growth to non-destructive activities, which is a more overarching kind of idea, both for the health sector and the other sector, but this proposal has not really made it into general practice. So perhaps this sort of challenge was identified already many years ago, some time ago, really. This German author started writing about a gap between the humanity technologically enhanced capacity to create and destruct. He noticed this gap between that and our ability to imagine that destruction. This is a reflection he came about when he was witnessing the Holocaust more than 80 years ago. However, he's carried on writing about it up to the 1990, and of course this is now being compounded by the information revolution, AI, etc. So I'm not putting this here to discourage ourselves from this task, but just to point that the uniformity of curricula isn't necessarily the answer. What I'm saying is some imagination about fundamental reform is really needed here, and it's a gap of the imagination that we are really trying to encourage ourselves to address, relax, play with it. That's what I'm trying to say. And therefore, objectives for today. Yes, we have these two objectives. You've seen them in the program. The first objective concerns an appreciation of the existence of multiple existing curricula represented around the table and online for educational health professionals about climate and broad environmental health. Also concerns an attempt towards convergence. Convergence, is there some overlap, similarity that may be recognized as consistent, coherent between different settings, different audiences? That's the first objective, which we can discuss today. The second objective is what Camille alluded to at the beginning. Can we translate that into practical tools like moving towards fruitful exchange of information towards the mutual recognition of possible learning units or practice units for accreditation eventually of the progress made, and so rolling out some of this kind of capacity. So it seems to me the two objectives that in this discussion we've come up with. So the program for today, we are now starting, well, we heard the overview from the host organization, Francesco, on the economics. We heard the various welcomes and background stories to this. So I would like to, have we have on time? I think the morning expects to have the keynote from Professor Haynes next, followed by some discussion. And then we have a remote link with Joachim De Eugenio, Policy Advisor for Zero Pollution Strategy, the European Commission, invited by the European Medical Association. Then we could have this early lunch. I think lunch will come before 12, so we have a gap between 12 and 1 o'clock. In the afternoon is quite heavy, I would say, but let's keep it light. 3 round tables. The disease model for the round tables was proposed by a professor of surgery who didn't see enough value about the general concept. He wanted to embed in undergraduate programs something that makes sense to medical students. So therefore we adopted that. And 3 round tables then will be followed by 3 more talks and before wrapping up before 5. So that's what we plan to do. We have a break in between the round tables and the final talks. So that's my just summary of the objectives. And so I hope you enjoy today.